How does genetic testing help to determine treatment protocols?
We have a couple of mutations that we have targeted therapy for, so that's one way it can determine the therapy. Second way is if a patient has a mutation that's known to cause very poor prognosis, then we somewhat know that they may not respond to chemotherapy as well as someone who does not have that mutation. So in that patient, rather than trying out our traditional approved chemotherapy, we may push to enroll them in clinical trials because oftentimes clinical trial can be better than more established chemotherapy, especially if we already know that a patient will not respond to chemotherapy. Another way would be if someone has a very aggressive MDS with a mutation that we know can cause aggressive MDS, then we may choose to treat that patient earlier in a more aggressive manner, whereas if you don't have that mutation, then we may sometimes even just watch without any treatment. A lot of MDS patients may not need any therapy for a while because MDS can stay dormant for a long time. So a lot of patients just get watched. But if you have a particular mutation that we know will not do well over time, then that we may choose to give therapy earlier.